Our topic for today is all about disseminated intravascular coagulation. Disseminated intravascular coagulation (DIC) is a serious disorder in which the protein that control blood clotting become overactive. Disseminated intravascular coagulation, also known as disseminated intravascular coagulopathy or DIC syndrome, is a complex and often life-threatening disorder in which widespread blood clotting occurs throughout the body. This excessive clotting can lead to the consumption of clotting factors and platelets, resulting in the bleeding diathesis. The hallmark of DIC is the activation of both the coagulation and fibrinolysis. This activation leads to the formation of microthrombi, small blood clots in the microvasculature. The microthrombi can obstruct blood flow and damage small blood vessels, causing microangiopathy. The consumption of clotting factors and platelets can lead to bleeding, which can manifest as bruises, petechiae, small red spot on the skin, or even major hemorrhage. The causes of DIC: when you are injured, proteins in the blood that form blood clot travel to the injury site to help stop bleeding. If there's protein become abnormally active throughout the body, you could develop DIC. The underlying cause is usually due to inflammation, infection, or cancer. In some cases of DIC, small blood clots form in the blood vessels. Some of these clots can clog the vessels and cut off the normal blood supply to organs such as the liver, brain, or kidney. Lack of the blood flow can damage and cause major injury to the organs. In other cases of DIC, the clotting protein in your blood are consumed. When this happens, you may have a high risk of serious bleeding. Even from a minor injury or without injury, you may also have bleeding that starts spontaneously on its own. The disease can also cause your healthy red blood cells to fragment and break up when they travel through the small vessels that are filled with clot. Some example of blood clot formation: the clotting factor, platelet and fibrin and red blood cells. Also blood sample for thicken and the blood clot in B cells. The risk factors for DIC include blood transfusion reaction, cancers, especially certain type of leukemia, inflammation of the pancreas, pancreatitis, infection in the blood, especially by bacteria or fungus. Also, the picture of healthy pancreas and the inflamed pancreas. Liver disease, pregnancy complication such as placenta that is left behind after delivery, recent surgery or anesthesia, severe tissue injury as inborn and head injury, large hemangioma, a blood vessels that is not formed properly, and also the picture of healthy liver and the unhealthy liver cirrhosis. The symptoms of DIC may be include any of the following: the bleeding from many sites in the body, blood clots, bruising, drop in blood pressure, shortness of breath, confusion, memory loss, or change of behavior, and the last one is the fever. Exam and test: you may have any of the following tests: complete blood count with blood smear exam, partial thromboplastin time, thrombin time, prothrombin time, fibrinogen blood test, and the D-dimer. The treatment: there is no specific treatment for the IC. The goal is to determine and treat the underlying cause of the IC. Supportive treatment may be include the plasma transfusion to replace blood clotting factor if a large amount of bleeding is occurring. Blood thinner medicine, heparin to prevent blood clotting if a large amount of clot is occurring. The outlook prognosis outcome depend on what is causing the disorder. DIC can be life-threatening, and the possible complications from DIC may be include bleeding, the number one, lack of the blood flow to the arm, legs, or vital organ, and the last one is the stroke. And the pathogenesis of disseminated intravascular coagulation (DIC) is characterized by systemic activation of blood coagulation, which results is generation and deposition of fibrin leading to microvascular thrombi contributing to multi-organ dysfunction. Furthermore, consumption of clotting factors and platelets can result in life-threatening hemorrhage. This is the sample pictures of pathogenesis of DIC. The activation of intravascular coagulation and the endothelial damage, and the activation of intravascular coagulation have a platelet consumption, coagulation factors consumption, and the fibrinolysis, and increasing and decreasing of platelets, and the increasing of prothrombin time and APTT, and also the D-dimer. And impaired coagulation and bleeding also have a sample pictures, and also the microvascular thrombosis, multi-organ eczema or failure. That's all. Thank you.